many couples face, and oftentimes folic acid, or lack thereof, can come into play. Dr. Jeremy Groll is here to explain. It's always great to have you on the show.
Thanks, Katie.
So I kind of want to ask about folic acid. You know, I know that Prenatal Vitamins have it. When I was pregnant, and a lot of women are taking it, it's all about folic acid. Do we have decreased levels, or do women, when they become pregnant, how does it work?
So it's normally you get that in your diet, usually with green leafy vegetables, so things like spinach and broccoli are high sources, but our diets usually are not sufficient in terms of getting enough to prevent what we can see in some pregnancy complications. And what it's important in is preventing neural tube defects. So these are things like spina bifida, and so either leading to troubles after the pregnancy is born or in terms of miscarriage. And interestingly, they've gone and looked in terms of the leading causes of miscarriage, and about a third are actually due to major structural problems like the neural tube.
Wow.
And so either from actualized miscarriage or from failure to implant, this plays a big role.
Yeah. So when we think about that, when we come to our doctor, if we're trying to conceive or we have, you know, we are pregnant, what kinds of questions do we need to ask you, or what kinds of things do we need to do as we, you know, progress?
So it's always better if we're thinking about getting pregnant to be on the folic acid beforehand, so it's in your system, and so that giving us our best chances. But interestingly, about 10% or more people are actually slow metabolizers, and so there's a very common gene called MTHFR where there's a common mutation where anywhere 30 to 70% of the enzyme activity in terms of converting what we eat into the active form, and that's what's involved with your neural development and the gene, you know, activation, so for the proper growth of the baby. And so a high number of people actually don't process the folic acid we eat, and then they're going to have a actual deficiency of how their body works as opposed to even just what's in our diet.
When you mentioned prenatal vitamins, and they usually have a higher concentration of the folic acid, there's so many different brands though. Do we get them over the counter? Do we get a prescription from our doctor? How do we know what to choose?
So you can get both. You can get them over the counter. With the prescription ones, they typically are going to have a higher overall content. Now there's a new form of folic acid called methylfolate, and that this is in some of the prescription prenatal vitamins, and that's the form your body actually uses. And so for people who have that slower metabolism, so if we know that they've had their, you know, mutation screen and they're a carrier of this, it's going to be much more important for them to actually get the methylfolate, and there we would want to get at least a full milligram a day. Most prenatals are going to contain 400 micrograms of folic acid. So if, you know, we have, you know, normal pregnancy and you tolerate the over-the-counters, well, that's usually sufficient. A lot of times I actually recommend Flintstones with iron.
Those are so good.
And so that they, you know, with 2 of those a day have enough to meet a prenatal. But if we know we've got, you know, a genetic mutation, or if we've had pregnancy problems, then I would probably get a prescription and get one with the special methylfolate, so that way we know we've got that part covered.
Real quick, about how long before we decide to get pregnant should we start taking the folic acid supplements?
So if we have planning, that a couple months beforehand, usually recommend at least 3 months prior to pregnancy, but obviously if we're pregnant, then to start it straight away just as soon as we find out.
Very good. As soon as you find out, or if you are having any trouble, go see Dr. Groll. Where are you guys located at?
We're over at the corner of Clio Road and Alex Bell, so it's 7095 Clio Road over in Centerville.
Thanks so much for being here.
Okay, thanks.